Hey everyone, Scott Luene here with Breakaway Seminars for our Dear Scott series. This is a series where you send questions in and I read them here on the video and do my very best to answer them. Go look at some of our other episodes. We have some really cool questions and discussions happening, and I really do hope that this is a good experience for you and that in some of these episodes you really hear something that resonates well with your practice and with what you want to do. All right, so let's start this sixth episode, and I've got my first question here. Dear Scott, I have added 2 new hygienists recently, and our hygiene reappointment numbers are going down. Help. All right, so what they're saying is they've got 2 new hygienists. Well, first of all, congratulations on being able to find and employ 2 new hygienists. It's hard today to find team members. So that was probably a lot of work on your part. Congrats. But now that you've got these 2 new people in hygiene, your reappointment numbers are down. That tells me that you're probably using metrics tracking software to even track your reappointment numbers, which is what we teach, for example, in our Business Masters seminar. And so you've been looking at these things month to month to month, and now you got new people and you see this number drop down. Congrats on looking. Congrats on once a month looking at this number to even see that it's changed, because you wouldn't feel it unless you look for it. So now what? You say help. What do we do? All right. Reappointment. Reappointment is, of course, incredibly important. Most practices think that their hygienists are reappointing 98, 99% of the patients for a future hygiene visit, and they're not. The national average is 59%. 59%. So there are some gaps in practices where people walk in, they get seen, and they are not scheduled for a future hygiene visit. What do we do? All right, I'm going to give you examples of 3 gaps where patients kind of fall and they don't get rescheduled. The first gap, patients aren't rescheduled by the hygienist to begin with. This happens in practices that where hygienists are asking patients if they want to be reappointed. We should not ask, but some hygienists will say to the patient, would you like me to go ahead and schedule your next cleaning with us in 6 months? That's a bad thing to do, because there will be a decent chunk of patients that say, no, I don't know my schedule yet. I'll call you to schedule it when we get there. We don't want that, because what we know is when we don't reappoint them, they don't wake up in 6 months and say it's time to call the practice back to schedule something. That's how they fall out of our practice. We have to reappoint them. We don't want to ask them. So the system isn't asking them. The system is picking an appointment 6 months later on a similar day at a similar time as today's appointment and telling them you've scheduled their next visit in 6 months. You hand them the appointment card, and then you say, and this is key, you say, we are going to call you 2 weeks ahead of this appointment to make sure this day and time works for you. And if it doesn't, we can reschedule it at that time. That's the script. That's what you say. It works incredibly well. That's one gap that we can fix. The next gap has to do with a new patient that needs scaling and root planing. Most offices, if a new patient comes in that needs scaling, they don't do any kind of prophy. They don't do any kind of gross debridement. They do nothing except diagnose their deep cleaning. And if a patient says no to the deep cleaning, they just walked out without a future visit. So it's important that even when patients need scaling, that we reappoint them from the hygiene chair into the future 6 months. If they say yes to the scaling, that will be their perio maintenance visit. If they say no to the scaling and walk out, we at least have them on the books for a 6-month visit. And if we had to, we could have them sign a release, and we can do a prophy, knock off the supragingival calculus, polish their teeth, and still have a shot at converting them to scaling. But this is a common gap that exists in praxis. You have to understand that it's okay to knock the calculus off of someone's teeth and to polish their teeth and to give their gums a chance for the inflammation to go down a little bit. if they have bone loss, if they need scaling and root planing. It's okay to do something before the scaling. And it's okay to reappoint them for that if needed. So if you've got the mindset that says, hey, if they've got bone loss, we're not going to touch them until they get deep cleaning done, then you're going to have a problem with people walking out and getting nothing done. But if you've got a mindset that says, look, when they come in, if they need a deep cleaning, first of all, don't call it that. If they need scaling and replaning, that's fine. We're going to knock off all the calculus and do something today. And that way we've got them in our system and they'll be healthier. And then we'll do the scale and root planing after they accept it. That's a policy that's going to have more happy patients. And those patients are going to get more care. And then you're not going to lose them. All right. Now, the third gap in reappointment has to do with the doctor's side. You got an emergency patient coming in, brand new to your practice, hasn't seen a dentist in 2 years. They broke a cusp. You sit them down, you look at them, they need endo buildup crown. But they also need prophy, but the doctors aren't diagnosing it. So what happens is they come in, you say endo buildup crown, you do the endo buildup crown, they leave without being reappointed, and then you don't see them again until some other cusp breaks at some point. What we need to be doing is we need to be bundling the diagnosis of prophy with the endo buildup crown. Mrs. Jones, as you know, you've broken your tooth and now you have an infection. We need to clean your teeth. We need to clean out the infection with a root canal. And we need to rebuild the tooth with a crown. And that is how you get the prophy accepted. Then you, of course, are doing the prophy that's on the treatment plan and you're reappointing them with your regular prophy reappointment process. And now you've retained the patient. All right, so there's 3 gaps, reappointment, and I hope that helps you. This is a very important thing to look at every single month. And when it's down, you have to address it. Oh, and by the way, if you are trying to make this number go up, you need to be communicating it to the team. Every week, you could post it, what it is. And every morning huddle, you remind everyone, we must have patients reappointed. And you can assign a daily audit to your receptionist, saying, receptionist, every single day, look at yesterday's patients and make sure every single one of those patients has a future hygiene visit. And that will be a safety net to hopefully also help you solve this problem. All right, that was the first question. Next question on episode 6 here, we've got, Dear Scott, I've heard you talk before about the importance of a patient checklist. Can you share more about that checklist? All right, so if you've heard me talk about it, you might have come to one of my seminars, maybe the Business Master Seminar, or I guess maybe you heard me talk about it on a podcast episode or something like that. But the concept of checklist. So first of all, anyone can check a box on a checklist and not necessarily even do the work. So we want to understand that just because we have a checklist doesn't mean people are actually doing anything. Just having a checklist and having people check it off doesn't mean the work got done. When we use a checklist, we must couple that with an audit. So people have checklists to help remind them everything they have to do. But the audit is going to bring accountability where we check to make sure the work was actually done. So I just want to kind of squeeze that little topic in there. Audits are incredibly important. The audit is the glue that holds everything together. The audit is where we get accountability. Okay, now back to the checklist. Every time a patient walks into our practice, they go through this assembly line process, basically, where they first stop at the check-in desk and 5 things have to be done there. And then they're taken down the assembly line to the operatory and 20 things have to be done there. And then they keep going down to the treatment coordinator and 8 things have to be done there. And every time they make a stop in one of these rooms, they have all these things have to be done, is an opportunity for us to use a checklist to remind us everything we got to do, to remind us to reappoint that patient, to remind us to post all the procedures as complete, including the 3 extra x-rays that we took today, to remind us to sign it to the correct provider, to remind us to take a PA of that crown we just seated so that insurance will pay for it. right? All of these stops are moments we might accidentally forget to do something important. So this checklist is going to be a reminder tool for everyone to make sure we've done all 39 steps that have to be done as part of a patient appointment. So this sheet of paper, this checklist, we'll have at the check-in desk, we'll have these 5 things listed, like mark them as arrived, update their contact information, make sure their insurance is fully verified, right? These different things have to be done at the check-in desk. And then they go to the operatory, take their blood pressure, update their medical history, take the x-rays, post the procedures as complete, set them to the correct provider, consent forms, reappoint the patient, so many things we have to remember. All of it's on a simple checklist. And the way checklists are used, by the way, in real life is not reading the list and saying, okay, now I'm going to update your medical history. Now I'm going to take your blood pressure. No, that's not how it works. What happens is patient seated and our team does everything they got to do. But before they let the patient walk out of there, they pull up the checklist and they audit themselves. Did I do this? Yes, yes, yes. Oh, I forgot to take the x-ray of that crown we just seated. Let me take that real quick. That's how the checklist is used. This is all about building an environment around our team that helps them become the best version of themselves. Just like a pilot has to have a checklist in order to make sure and remind them of everything they got to look at before they take off. Our team has to have a checklist to make sure they're not forgetting something either, because we're all human. We can all forget something. Back to the pilot example, the pilot has a checklist to make sure landing gear is working and everything's ready to go, but the co-pilot is then auditing their checklist, also making sure everything's ready to go. That's a great system to achieve a high level of performance. That we have a checklist to remind us of everything we got to do, and then there's an audit to hold us accountable to that, to make sure we didn't skip over anything. All right? That's the patient checklist. I hope that answered your question. If y'all have any questions, send them to me. Find me on Instagram, dr.scott.leune. Find us on LinkedIn, Facebook. Go to our website, breakawayseminars.com, and send us your questions, and I will do everything I can to answer them here on the Dear Scott episode. Also, again, look for the other episodes. Some of these questions are really cool, really valuable topics to talk about, and I hope that this adds value to your day and to your practice. All right, until the next episode, thank you very much.